traditional medicine. When I talk about traditional medicine, I'm talking about hospitals, pharmaceutical companies, anybody in medicine, anybody who makes their money in medicine, who gets reimbursed from insurance companies. They don't make money off of two types of people, healthy people and dead people. They make money off of chronically sick people. It's like a built-in incentive structure, but it would be nice if you had a healthcare system where doctors were incentivized to keep you healthy. They don't have a platform for telling people about all these health hacks that keep people healthy. And I thought it would be fascinating to tell everybody about that and really spotlight the people that are making this happen, staying vital, staying healthy, staying sexy, staying young is what living life is all about. And if you have doctors that have proven treatments that keep people young and healthy so they don't get sick, you want people to know about these treatments and that they exist.
This show comes out every Tuesday. Always looking for the latest, greatest health hacks. We've already covered an enormous amount of information. This is a really exciting show. And so what we ask you to do, if you're listening to this on just the audio, subscribe to it at iTunes. Just hit that subscribe button.
I'm here with Dr. Bauman with Bauman Medical. Dr. Bauman, I'm honored to have him on the show. He's a friend of mine. He's also one of the pioneers in hair restoration. You've trained literally hundreds and hundreds of doctors, and you've treated over 30,000 patients in over 22 years, correct?
That's right, Mark. Yeah, great to be here with you. I'm excited to be with you here today.
Thanks. And you've had quite a lot of experience. You've been on the cutting edge of a lot of treatments that have really helped men get back their hair and ultimately just get back their confidence.
Well, that's absolutely right. I mean, when I started the practice here in Boca Raton, Florida, over 20 years ago, I didn't really understand just what the need was out there for hair loss treatments and hair restoration and hair transplants. But I learned fast, and it's been a great 2 decades of work, and it's been exciting and really pleasurable to treat about 30,000 patients and to perform over 9,000 surgeries in the surgical suites.
So how did you get into hair restoration to begin with? Was that always your passion?
Well, I guess I would say it started at a pretty young age. When I was in high school, I watched my dad go completely bald. And so, that affected me quite a bit. I mean, I did know that there was a genetic component. Even, I looked at my grandfather and he had a lot of hair loss, and my mom's dad had a lot of hair loss. And the old wives' tale that, it does run in the family. It's not just the mom side anymore. We know it is the dad side too. But I always wondered if that baldness was going to happen to me. And I always loved my hair. I wanted to keep my hair. And I was always kind of fearful in the back of my mind, am I going to lose my hair like my dad did? And, he eventually did lotions and potions. And of course, there were no transplants that were great and available at that time. In the in the 80s, he went and got a hair system actually, and it wasn't till much later on did I get a chance to transplant him and really put all of his hair back, really to transplant a full head of hair for him. Well, but first of all, that was definitely that's how it got started. I mean, I always thought I loved my hair. I wanted to keep my hair. I grew long hair in college and then again in medical school, and only cut it really for my graduation when I had to get a job.
So you get out of medical school and you went right into hair restoration.
Well, not exactly. So the clock back a little bit. My first mentor was a plastic surgeon from the Upper East Side of Manhattan, and he mentored me from the time that I really began my interest in medicine and surgery, of course. And I really loved watching him work. I mean, he was a little bit of an OCD surgeon, which is the kind that you want. And he was certainly great with his patients. He had an amazing bedside manner. And the other part of it is that he did this amazing artistry to really turn the clock back for his patients using plastic surgery techniques. And, that's what I wanted to do. I wanted to go into plastic surgery. And it wasn't really until much later on when I went through medical school, did 2 years of general surgery, internship and residency, but then found hair transplants after that.
Now, when hair restoration, we talk about it being an art, yet you see so many doctors getting into it who really don't have the eye for art. They say, well, no, it's just another medical procedure. Like, why? How does the artistic come in? Were you always artistically inclined?
Well, so I was never a great, I mean, I love to doodle, no doubt about it. I was never a great drawing artist. My mom was an oil painter, though. My dad is a dentist. So somewhere between, his medical, dental aspects and maybe my mom's skill on the canvas with her oil paints, I inherited a little bit of each, perhaps. So, but what my mentors taught me is that in order to be good in cosmetic surgery, you really have to be a student of nature. So I guess that, if you're going to like paint a picture of a tree, you better know what a tree looks like, right? Have a good idea of that. And so if you're going to create a hairline, you better be a good student of natural hairlines, and you better be attentive to how Mother Nature does her business, right? Whether it be a swirl in the back of the scalp, or the way that the eyebrow hairs lay down in an eyebrow, or the way that a natural hairline is going to have a wavy shape to it, not a straight line, of course, and how the hairs angle so that they create coverage, which is really what hair's all about, putting back coverage to these areas to reframe the face.
So in the 1990s, though, did we have the techniques available to give men that normal looking, natural looking hairline?
Well, it was just starting. And that's actually what drew me into the field, because when I met a patient before I knew anything about hair transplantation, and he had told me that he had had a hair transplant done, and I was basically unable to tell that his hair was transplanted, that really struck me. And of course, as a surgical resident, you think you know everything about everything. And I asked him some pretty detailed questions. First of all, like where he had his hair transplanted. And he replied, well, up in Toronto. And I thought, well, that was interesting, but I really wanted to know where on your scalp you had the hair transplant, because it doesn't look like one. And he began to tell me about, in layman's terms, about single follicle implantation. Again, this was in the mid 1990s, when not everybody was doing hair transplants that way. So what I learned quickly in that brief conversation with a patient who had had a hair transplant was not only about a little bit of the technology, that it could fool someone, it could look natural. It was not pluggy like what I thought it was going to be. He told me that the process was comfortable, so it wasn't a painful process. And of course, he was thrilled and ecstatic about the results. So it told me about the payoff on the back end. What do the patients get out of a hair transplant? And I always stuck all those three things really in the back of my mind as I started to look at hair transplantation as something that I wanted to learn more about.
So when you talk about single follicle transplantation, you're talking about going one hair by one hair, moving it over. It sounds like it's going to take forever to do that.
Well, here's the thing. So back in the 1990s, the harvesting was not done one at a time. The harvesting was done in a strip. So we used to take, with a scalpel, a linear harvest out of the back of the scalp, which created a linear scar that we would have to obviously close with stitches or staples, and then give that tissue, which contained thousands of follicles, to a team of technicians. And these medical assistants would dissect out the individual groupings of hairs, and whether they be groups of ones, twos, or threes, we could tell them which ones we wanted to create. And then, of course, artistically implant those grafts into position. So that was the old school technique, the linear or FUT, follicular unit transplant process. But today we have a process called FUE, follicular unit extraction or excision, whereby we take each individual graft one at a time. And so that's the latest and greatest. So there's no linear scar, there's no scalpel or stitches or staples, and a lot less downtime, a lot less discomfort. And I'm proud to have been part of a small handful of physicians who helped pioneer that about 10 to 15 years ago.
So once that was pioneered, though, then you hear about these robots now that are doing that. Do you think the artistic component now is overlooked by a lot of doctors?
Well, look, I think the artistic component is overlooked by many people. Even in the consumer side, patients don't necessarily understand that they need someone with an aesthetic eye to execute, to plan out, and to actually design and make those sites in a correct angle, orientation, and position so that the end result looks right. I mean, we don't plant follicles perpendicularly in the ground like a bed of roses, or field of tulips. We got to angle each and every one of them so it looks normal. So, but robotic harvesting has been available for a number of years. I own one of the robots. It's by Restoration Robotics, called the Artis. And the Artis is the most sophisticated semi-autonomous surgical instrument on the planet. I mean, it's awesome. When that thing's up and running, it's like Star Trek, in the office. But the robot's not going to make decisions in terms of where to put the hair. It's just going to help us really harvest the hair follicles. And that's one of the tools that we use to get the follicles out of the scalp in a minimally invasive way.
Now, how do you go about training other doctors? Like, walk me through that. Do they just come up to you and say, "We've heard a lot about you, teach me," or was it something you've always been passionate about?
So, I've been teaching and training physicians for a very long time, and physicians sometimes will just come in and observe for a day or a few days or even a week. And other physicians want to learn how to do the medical management part of hair loss, because I think that's really overlooked. They want to add that to their repertoire of treatments that they may be offering. In their medical practices, how do we slow down and stop the progression of the baldness? How do we get the follicles to rejuvenate? What kind of biohacking methods can we use to really treat and track the results of that so we get an effective result, an effective outcome, if you will. And then other physicians want to come in and learn how do we do a hair transplant physically? How do we take the hair follicles out? How do we design a hairline? So every physician comes to me with a little bit of a different story and a little bit of a different goal. But, at Bauman Medical here in Florida, we've got what we call the Bauman Institute. And if you're a physician out there and you want to learn how to do the medical management, you want to learn how we do a hair transplant, you may want to learn eventually to do the procedures on your own, then the Bauman Institute is the place to start. And there's stuff that you can do online. There's stuff that you can do here in the office. We have quarterly training programs that we offer. Depending on what your needs are. So, I encourage physicians and healthcare practitioners, and even today, PAs and nurse practitioners are getting into the field at a rapid pace. They want to learn how they can help physicians do hair transplantation. So it's a pretty exciting time. It's definitely exploding. I mean, everybody needs and wants more hair. So, being able to provide that, that level of service, not only for our patients, but also to provide the teaching and the training in the office, as well as at the conferences that we attend, is super exciting.
Well, let's talk about other ways for a man to get back his hair that is not hair transplants. There's I actually read that in the future, getting a new head of hair is going to be something that's really easy with different pills and genetics and CRISPR. Have you studied any of that?
Well, look, if you ask a hair researcher about hair cloning, they'll tell you that, oh yeah, it's coming down the pike. It's just another 5 years. And that's kind of been the joke of the industry.
It's always been a couple of in the 1990s, it was 5 years away.
Exactly. And I don't know if that's just job security, that they say, oh, it's another 5 years. So they get some additional funding, whether it be academia or from shareholders, who knows, venture capital, I don't know. But no, there's definitely been a lot of strides out there in terms of treating hair loss in the bioengineering circles, and going to different conferences like the World Stem Cell Summit and things like that really open our eyes to what's the possibility could bring. So, for example, some good friends of mine out there in Sanford Burnham in La Jolla in California are using induced pluripotential stem cells to create a pathway to essentially unlimited numbers of follicles. Now, it's not available yet. You can't sign up and get that infinite supply of hair follicles for humans today. They're working on mice and rats, obviously, but this technology could have great benefit in the future. And it's no secret that companies like Allergan, for example, are invested in this. So, when you get Allergan's attention, that means that you're onto something. And certainly Alexei Turskik and his team over there, Jeff Hamilton at Stemson, are doing a great amount of work. So the latest and greatest is the fact that they've got now the hair follicles that have been essentially multiplied in the laboratory and now implanted into those mice. They actually got the hairs to grow out of the scalp, out of the skin, which would eventually be the scalp, obviously, using a really innovative tool. It's kind of like a little cup that goes in, that dissolves under the skin to get the follicle organized on a cellular level and to direct the hair in the proper direction so it exits the skin. So look, stay tuned for that. There are a lot of other scientists doing some great work in Japan and China, as well as in the UK. The UK has hair follicle cell banking now, where you can, take a couple of biopsies of your hair follicles and bank them into, maybe deep freeze them, for example, so that eventually they could be duplicated down the line. So who knows? But I'm excited about that kind of technology. But, the good news is that you don't have to wait for hair cloning today. You can arrest the hair loss process using, tools and techniques that are currently available right here in the clinic, like today. Right
Okay,
now.
so let's talk about, I know there's PRP, and you've created something very unique, PDO Grow. So,
Correct. So I guess the latest and greatest stuff that people hear about are the lunchtime type hair growth treatments. So PRP, platelet-rich plasma, is not a new therapy. It's been around in sports medicine for tissue regeneration and repair for probably close to almost 20 years. And where we were using platelets in cardiothoracic surgery back when I was a resident almost 30 years ago.
mhm.
So the effect of platelets and the powerful growth factors that they contain is not something new. But what we've learned is how to harness those growth factors and get a great result in terms of hair regrowth for our patients who are in the process of thinning. So if you're in the process of thinning, you've got a little bit of time as the follicles begin to miniaturize and weaken before they're dead and gone and before they're beyond repair. And that's the time to take action, whether it be with a medication or a laser light device or a lunchtime procedure like PRP. So PRP in my office, we've been doing about 10 years, over 6,000 treatments, and a single treatment will last about a year, meaning you'll get a boost of the weaker hairs growing stronger for about a year. Now, what you asked about is called PDO Grow. PDO Grow is a little bit different. One of the tricks to getting the PRP to last an extended period of time, that full year, is the use of scaffolds. So you can have cellular scaffolds, things that you would inject in addition to the PRP that the body kind of works on and uses as a foundation to act upon and release growth factors and create that tissue regeneration and repair. And I guess regenerative medicine uses that troika, if you will, the triad of cells, signals, and scaffold, usually to create that result. So PDO Grow uses now a synthetic scaffold in addition to the other things that we're doing with PRP. So PDO stands for polydioxanone, which is a substance that's been around for 40 years, FDA cleared as a deep suture material that dissolves over a long period of time, 6 or 12 months in the body. And we used a lot of it in general surgery when I was a resident. And we even used it when we were using the linear closures in the old style hair transplant procedures to give a lot of tension under the skin. Of course, we don't have to do that anymore. But you may be hearing about PDO as they use it now aesthetically in the skin of the face. So they use it for facial rejuvenation, to increase collagen production, to increase blood vessel formation, and these powerful releases of growth factors can regenerate skin and collagen and so forth, and give you a tightening and also a lifting effect depending on the kind of material that you use, the kind of threads. And I heard through the grapevine that these threads are being used in the Far East in the scalp for hair rejuvenation. And at first I was very skeptical. I didn't really believe it. I did a little bit of research. I spoke to a few physicians by email and by phone, and they encouraged me to try it. And so we got a hold of some of the FDA cleared materials, and under local anesthetic, we started implanting these threads under the scalp. And we did a pilot study, less than 10 patients, but we did a pilot study. This was about a year and a half ago starting. And what was amazing is that we saw a great regeneration and rejuvenation of the weaker hairs. And it was pretty quick. Within about 3 to 6 months, you really saw some action out there. And we were encouraged by that. So we kept going. We finished off the clinical trial and we presented that material, the results, as well as the photos, in the South Beach Symposium this year in Miami. And it was really very well received. We actually performed the procedure live in front of hundreds of physicians. And since then, the demand is exploding for PDO Grow. So we're really excited about it being on the cutting edge. I think I was the first physician to do it here in the US, at least the first for sure to teach it and show the process and to really get a handle on what makes that work.
What kind of guy is the ultimate candidate for PDO Grow? Who's it going to work on?
So PDO Grow is going to work on someone who still has some hair follicles there. So for example, who's not a candidate? If you have a big bald spot, it's smooth and shiny in the crown, or your hairline is deeply receded, PDO Grow is not going to fix that area. It's going to work on the rest of the hair to keep those hairs growing thick and strong and healthy. So just like you would use medications like finasteride or minoxidil, or laser light therapy at home, PRP in the office as lunchtime treatment, PDO Grow is designed to protect and enhance the function of the follicle. But it's not a permanent result. It's only going to stick around for a period of time, maybe about 6 to 12 months or so before it needs to be repeated. And, that data is forthcoming. We don't know exactly how long it's going to last.
So you're really on the cutting edge. When a guy's doing PDO grow, does he still like, is it going to benefit him doing low laser light or any of the other treatments, or is this a standalone treatment?
Well, that's a great question. And so what we find is that these therapies, the ones I've just mentioned, whether it's finasteride, which blocks DHT, now we can use that orally or topically.
Mhm.
Minoxidil, which is typically a topical medication. We use the 82M version of that, which is a compounded version, which penetrates better, not greasy, or laser light devices like the Turbo Laser Cap or Capilis RX. Those are the high end and top quality treatments. Those all work in different ways. So the treatments are not redundant. They work synergistically. And the PDO Grow is the same. So PRP and PDO, those are going to work differently than the medications, than the laser does, than the topicals do. And, when you add these things together in any area of medicine, multi-therapy always works best. Why? Because you get this additive effect. This plus this is not that, but it increases. You get some synergy, which is awesome.
1 + 1 + 1 equals 111.
Yeah, right. Exactly.
If my math is right.
Right, exactly. So, how much of an improvement can you get? Some people tend to respond better from laser light than they do from minoxidil, and some people respond better from finasteride than minoxidil. So, sometimes you have to try, different types of modalities, and that's what I've learned is that there's no one cookbook, for regrowth. Every patient is different. And so, like, I hear people talk about their protocols at conferences, and they're very dogmatic about this is the way it needs to be done, and that's it. And I just know that they're not treating large numbers of patients because I'm proven wrong.
Yeah, one
every
track
week.
pony. Yeah, it's like
I'm proven wrong every week. In the office, I treat about 1,000 patients per year, and there's always a surprise. So that's what hair loss management is all about. That's what keeps it interesting. And the tools that we have enable us to measure and monitor, and help these biohackers who are really trying to optimize their hair get going in the right direction. Because without the data, you can't manage it. You can't, if you're not measuring, you're not managing, and that's it.
I love that term, hair loss management. That's actually a really cool term. I wish I found a hair loss manager when I was in my late 20s, because it's a lot harder to find that when you have nothing to manage. So
yeah. So if you have nothing to manage, then you're going to be signing up for a hair transplant, in order to get the job done. And of course, the technology is great on that end too. Many patients need both, right? Because they're still in the hair loss phase. If they're still alive, they're still losing some hair, and then they need the transplants to move the permanent hair from the back into the front.
So really a guy in their late 20s, early 30s, they're losing their hair, but it's not gone yet. They really don't need a hair transplant. They just need a good hair loss manager. And then when they're in their 50s, they'd have a head of hair like you, which is a great head of hair. So,
well, thanks. I've been fighting hair loss for decades. It's no joke. It's not a secret. I use a Turbo Laser Cap. I use medications to help my hair grow thick.
But you've never had a transplant, correct?
I've never had a hair transplant, but I've been in the field for a long time. I've been practicing hair restoration for almost, 23, 24 years, a long time. So it's a fight. It's a daily fight, actually. And, but you're absolutely right. I have patients in the practice who I've been treating for 2 decades who look about the same as they did when I started with them. And the reason is because they're using the treatments that are effective and they're compliant with them. And, today the measuring and monitoring tools are even better than ever. I mean, we've got microscopes that attach to iPhones, and we use that every day in the clinic. And we've got measurement tools to actually track different areas of the scalp without having to shave any hair, without having to put a tattoo. We can go back to the same area again and again and know exactly what's working and how well.
I was actually blown away when I went up to visit your clinic. Oh man, like cutting edge, high end technology, like stuff that blew my mind. Well, let me ask you, if a guy cannot go to Boca, but he wants PDO Grow, I know you've taught other doctors. Is there a network of doctors out there that people can find?
Yeah, for sure. So we have a network of physicians and other practitioners as well. Sometimes they may be beauty professionals who can do measurements for you, but not prescribe or perform treatments. Then there are physicians who have taken my class and done the training. And you can find that list at coachmyhair.com. But I'm personally performing procedures here every day in Boca Raton, Florida, in the nearly 12,000 square foot facility that we built. But I also do pop-up PRP and PDO Grow treatment weekends, if you will, or even during the week in New York City.
Wow.
So in fact, we did one last month. It was very well received. We had more people that we could handle. So we booked another one for next month. We'll be going back to New York. So if people are interested in getting treated or measured or evaluated, they can come and see me in Boca Raton, Florida. They can see me at my pop-ups in New York City, which are going to definitely be continuing. Or as half of our patients do, they can find me online and we can have a virtual consultation, much through this video technology that we're using today, whether it be Zoom or Skype or FaceTime. We can consult with patients from all across the world, and we do. Because nearly 50% of our patients that come in for a procedure, they come in from more than 100 miles away. They're flying in for a procedure or treatment or evaluation.
So what's the investment in PDO Grow, the annual investment range out there?
So the cost of PDO Grow right now, and this may change over time, it's $5,600 for a treatment. That's a single treatment that is going to last you approximately a year.
Okay, which is a lot more reasonable than a lot of the hair transplants out there. And obviously it's your own hair, so it's natural.
Correct. And remember, it's doing something completely different, Mark, than what a hair transplant does. It's really giving your existing hair follicles a boost so that you may never, ever need a hair transplant. Well, that's the exciting part, you know?
That's amazing. And I think really we're on the cusp of great things in hair restoration. I love the stuff you're doing. I think, it's brilliant coming up with PDO Grow. And, I think the most important thing and the whole thing that this whole podcast is about is bringing providers on the show who are doing things different, who think outside the box, who are cutting edge, who don't believe in like the old dogmas. So, I think it's great. It's awesome.
Well, it's a pleasure to be here. I mean, we've certainly seen our patient base change within the past 5 to 6 years or so. The people who are really taking control, learning about the latest and greatest technologies, not just going to the regular old dermatologist who may not have any idea how to measure hair or even look at the scalp. I mean, we have, unfortunately, so many women that come to the practice, for example, as well, and men, and they're being spoken to by their dermatologist, and the dermatologist didn't even look at their scalp, much less measure it. I mean, they're just looking at them from across the room. It's terrible. So, using the biohacking tools that we have, we can really track exactly what's going on. So we can measure, monitor, and manage, right? The key, the hair loss process.
Well, now you just mentioned one thing that we didn't even talk about, which is women. Everybody thinks about hair loss in men. What percentage of your patients are women?
I think you're going to be surprised to find out that 50% of my patients are women.
Wow, 50%. That's hard to believe.
Well, hair is important, just as important for women as it is for men.
It's actually probably, I would say it's way more important because you see bald men out there. You don't think it's unusual, but you never really see bald women.
Right. So I said that a little tongue in cheek because hair is, of course, important for both men and women. And no matter who you talk to, they always think it's most important for them. But here's the thing. So in the male pattern hair loss, there are socially acceptable options. You could shave your head and theoretically go out and about and, nobody would look at you any different if you're a man. But there's no option to shave your head if you're a woman. It's impossible. The interesting thing is that hair loss in women is sometimes more difficult to treat because there's multiple factors that influence the hair follicle in female patients, not just hormones and heredity, but also stress and nutrition and sleep-wake cycles. A lot of lifestyle factors can also influence hair follicles in women. And also in women, the hair loss process looks a little bit different. In men, you can see the hairline recede from across the room and you can see the bald spot developing in the back of their crown. But in women, it's a diffuse pattern, which is going to happen through the middle zone. And they're going to style and use some camouflage, whether it be color or other products and things like that, to camouflage the problem a lot easier. And so you're not going to look at a woman and say, oh, she's lost half her hair. Because she's got a good amount of coverage. But there are a lot of women out there who look exactly the same as they did 10 years ago, but they have literally 1/2 the amount of hair that they did at that time. And those are the women that we treat. We treat women who are in the early stages, middle stages, and also the later stages of hair loss all the time.
Do you also get into lifestyle hormones with your patients?
So we don't We would certainly do a discussion about lifestyle factors that might be influencing their hair. We take a detailed medical history. So we learn a lot from just talking to patients, obviously, about their symptom profile, their risk factors, their medications, their medical conditions, as well as their risk of hereditary hair loss. And of course, examining the scalp tells us even more. We can do blood work. We can do biopsies if necessary. Very often, patients already have their blood work, you know. In this day and age, everybody's got their most recent blood test with them typically. And the good news is it's covered by insurance, whereas my procedures and treatments and evaluations are not. So patients will often come in with their blood work. And sometimes, rarely, we do find irregularities in the blood work. But I'll have to tell you that the hair loss occurs in the scalp much quicker than it occurs in some kind of blood test. Right. Honestly, so we work very closely in conjunction with age management physicians who are doing hormone replacement therapy and other functional medicine physicians. It's really important. We work hand in glove with them because they may not necessarily have the knowledge and the skills and the tools and the techniques for hair loss. And we don't have the ability to measure, monitor really all those wellness factors that a functional medicine physician would. So it's a perfect marriage. And we work very closely. We refer out to many age management physicians across the country, actually.
That's exciting. Now, how does a patient listening to this get in touch with you?
So if you're out there and you're suffering from hair thinning, you think you might be seeing more hair in the drain, in the brush, in the bed sheets, or you've got a receding hairline or some thinning area that you have to cover with a different hairstyle or something like that, you got to get to BaumanMedical.com. You can get information there. You can request a consultation directly from the website. And you just put in your information there, and my staff, who is amazing. I have the most amazing staff in the world. I have over 20 staff members. They will help you get on my schedule, and we can chat about your hair loss situation. We can look at the blood work that you've already had done. If you're in town or you want to come in, we can certainly measure you. But the process starts virtually very often as just a conversation about what's going on and what you might be already doing to treat your hair loss process. And let us refine that. Let's tweak it up a bit. Maybe you started Rogaine already. Well, let's get you on a prescription version like the 82M. Or maybe for men, they've been on finasteride, but it doesn't seem to be working. They're getting it from Hims or Keeps or Roman, and they need something more bespoke. They need something more customized, like a topical finasteride, so we can reduce the side effects. So all of that can happen virtually through that consultation through BaumanMedical.com. And obviously, if you want to click to call, you can do that from the website too.
Awesome. Dr. Alan Bauman, pioneer, definitely cutting edge. So happy to have you on the show and the real deal. I mean, there's so many doctors out there in this industry that are not the real deal. Dr. Bauman, you are it. So thank you so much for your time. We really appreciate it. And we appreciate the work you're doing.
Well, thanks, Mark. It's really been great to be on with you and to try to help those who are struggling out there with the hair loss process and change your lives for the better.
Great. Thank you so much.
If you'd like to find out more information about Dr. Alan Bauman, go to BaumanMedical.com or haircoach.biz. Also, don't forget to subscribe to Health Hacks with Mark L. White. Go to Apple Podcasts, Google Podcasts, and subscribe, or on YouTube, marklwhite.com. We'll see you next time here on Health Hacks with Mark L. White.